Hello, Mrs. Hernandez.
Hello.
I'm Fabian Hernandez.
Maria Hernandez.
I'm a physician assistant student that's going to be asking you a couple of questions today on behalf of my supervising clinician. Is that all right?
Yes.
Okay, before we get started, how may I address you?
Maria Hernandez.
Okay, Maria. Can you tell me what brings you into the clinic today?
Okay, the last 3 days I have fever.
Okay. Can you tell me a little bit more about your fever?
I just need, I just feel tired, dizzy, and I just wanna go to the bed and stay in the bed.
Okay. Do you feel like your fever is constant, or
No, they come and go.
your fever comes and goes?
Yes.
Okay. And have you had any sick contacts?
No,
Any sick family members?
no,
What about any new medications? Have you taken anything different that you've never taken before?
no,
What about any new foods that you've tried?
no,
No new restaurants?
no,
Okay. Have you noticed any weight loss since the beginning of the fever?
no,
What about a rash?
no. I just don't have appetite.
No appetite?
No.
Okay. How high was your fever the last time that you checked?
102.
Okay. And has it been 102
No.
for the 3 days?
Sometimes 100, sometimes 98, something. Last night 102.
Okay. Do you feel like this is the worst fever that you've experienced?
Yes.
Is there anything that makes your fever better?
No, just be in the bed and I feel better.
Okay. What about anything that you feel that makes your fever worse?
No,
Okay. Have you taken any medication for your fever?
just a little.
Tylenol? Okay. How many times?
Every 6 hours, 2 tablets, 250 milligrams.
Okay. And do you feel like that's helping you with your
A little.
fever? Okay. How about, have you experienced any cough?
No,
What about sore throat?
no,
Any chills?
no,
What about any nasal congestion?
no.
How about any headaches?
Yes.
Yes.
A little.
And the headaches come and go?
Yes.
Are you taking anything for your headache?
No.
Okay. I'm gonna go ahead and summarize everything that I have, just to make sure that I have all the information correctly.
Okay.
So you've had a 102 fever for the last 3 days that you feel is only getting better with bed rest.
Mm-hmm.
You've taken Tylenol, 2 tablets every 6 hours
Mm-hmm.
with some relief.
Mm-hmm.
You've had some headaches during the last 3 days, but you're not currently taking any medication for your headaches.
Mm-hmm.
And you haven't experienced any chills or any sore throat or cough
Mm-hmm.
for the last 3 days. Okay, I think I have all the info that I need regarding your current condition, Maria. I'm gonna go ahead and ask you some past medical history questions, if that's okay with you.
Yes.
Okay. Do you have any allergies that you know of?
No.
What about any allergies to medications?
No.
Are you, to the best of your knowledge, in your past, did you have any illnesses, serious illnesses, for example, like diabetes?
No.
Okay. What about any hospitalizations?
No.
How about any surgeries?
This is cesarean.
A cesarean section?
Mm-hmm.
C-section?
Yes.
Okay. How long ago was that?
13 years ago.
Okay. Did you have any complications?
No.
Okay. Have you had any serious injuries or any falls
No.
in the past? Okay. Have you traveled outside of the country in the last 3 months?
No.
I'm gonna go ahead and ask you some personal routine questions that we ask all our patients. These are just for our records, and this is just so that we can better take care of you.
Oh.
Okay, Maria, this is in regards to your reproductive history. How many children do you currently have?
I have 4.
4 children. And how many pregnancies?
4.
4 pregnancies. Have you noticed any fertility problems?
No.
How about any complications during your pregnancies?
No.
No? Okay. In your youth, did you have any youth illnesses, for example, like chickenpox or rubella?
No.
Are you up to date with all your
Yes.
youth immunizations?
Mm-hmm.
Okay. And can you tell me the last time you had a tetanus shot?
I don't remember. No.
Okay. We're gonna go ahead and check if you have any records of vaccinations just to make sure that you're up to date, okay?
Okay.
What about your last flu shot?
Last year.
Last year? Okay.
Mhm.
Okay, Maria, I'm gonna go ahead and ask you some questions regarding your family history. And when I mean your family history, I'm talking about your immediate family, such as your parents, your grandparents, your siblings, and your children, okay?
Okay.
Are you currently concerned or aware of any conditions that may run in your family?
No. Not that I know.
Have you noticed any family members that may be suffering from diabetes?
No.
What about hypertension?
No.
How about cholesterol, high cholesterol?
No.
Any history of cancer in your family?
No.
Okay. Have you seen any of your family members experience any hereditary illnesses such as anemia?
Yeah, no.
No? What about sickle cell?
What is it?
Sickle cell is a hereditary disease that
Oh.
causes anemia.
No.
No? Okay. Have you noticed in your family any pregnancy related complications?
No.
What about any miscarriages?
No.
Anybody in your family suffer from gestational diabetes?
No.
Okay. How about any psychiatric
No.
conditions?
No.
No? So nobody in your family has experienced schizophrenia?
No.
What about depression?
No.
Are you aware if any of your family members have been exposed to any toxic substances such as lead?
No.
What about any drug or alcohol dependency? For example, let's say having a family member that's an alcoholic.
No.
Okay. Well, I think that's all the questions that I have for now, okay?